So my name is State Representative Julie Rogers. I currently serve in House District 41. That is most of the city of Kalamazoo, most of Kalamazoo Township, a slice of Portage, and a slice of Comstock. And I am in my second term. I like to say I'm a physical therapist first and a legislator second, and that is because I am still a practicing physical therapist. I really have had a passion for helping solve my patients' problems, and they've encountered a number of policy issues that I've been excited and had the honor to help work on solving. I also had the pleasure of serving in county government for 8 years. And so I feel like I was able to hit the ground running in Lansing. I also have the pleasure of serving as the House Health Policy Chair this term, which means I get to set the agenda for what we're taking up in the Health Policy Committee. And I also serve on the local government committee, and my county commission background also serves me well there. The other two committees I am on in Lansing are military veterans and homeland security, as well as the insurance and financial services. I feel that we have made some really good strides and progress in Michigan in the state legislature over the last term. I will say I work well with others no matter what party they are at. And my first term, I served in the minority, reached across the aisle and worked collaboratively to pass my first bill. And this past term, we were able to make some bigger investments in our community. One of the things I'm most proud of is finding funding in the state budget to fund free breakfast and lunch for all public school students K through 12. I'm also really excited about working on equity issues. It is no secret that Black babies die at a rate of 3 times the rate of our white babies statewide, but especially in Kalamazoo County. We are currently working on a maternal infant health package of bills to try to address some of those disparities. But because we've had hundreds of years of marginalization, I think it's going to take several years to turn this ship around. I also am excited about some of the strides we've made in environmental policy and was proud to vote for the climate energy package. Sure. So I have a master's degree in physical therapy. I am very excited to be the House Health Policy Chair, and I think my background and experience in healthcare serves me well for that role. I also came from county government, serving 4 2-year terms in county government, part of that time as the board chair. I served at the state level while I was a county commissioner and was on the Michigan Association of Counties executive board. I also wear two leadership hats in the legislature. I am a caucus co-chair for the Biosciences Caucus, and I am also one of the Arts and Culture Legislative Caucus co-chairs, championing funding for the arts and exposing the members of the legislature to some of the arts in our communities. So it is difficult to narrow down the three most pressing issues because there are so many, but I will say at the top is why I'm continuing to run for office and serve is access to affordable health care. Throughout the state, we have access issues, and I am proud to have championed and worked with others in my committee to shepherd the telemedicine access bills that goes a long way in helping people access their healthcare providers, whether that be in a rural setting or just because they're a working person and sometimes don't have the luxury of taking time off of work for a medical appointment. And it also has helped with people with behavioral health, mental health issues, and or substance use disorder. Sometimes people have said there's a stigma attached to going to a physical office, and having the luxury of being able to take a medical appointment from your home or from your car or wherever you would like to be telemedicine has helped with that access issue. I also would say infrastructure is another top issue in Michigan. that be infrastructure of our roads and bridges that are crumbling with lack of investment over the last decades, or broadband infrastructure and access to the internet. Um, a solution for that is, of course, direct funding. And I was proud to champion alongside some of my colleagues from Kalamazoo, acquiring $28 million over the last few years in state budget money to redirect and redesign the Business Loop 131 interchange. It only goes in the north-south direction right now, and it's very difficult to get from point A to point B. I also think it will address some of the air quality issues in our north side neighborhoods by more efficiently and more expeditiously getting truck traffic out of the neighborhoods and back onto a major highway. The other issue I started to touch on is environmental concerns, and that's all encompassing, whether it be lead poisoning in our children or air quality, like I mentioned earlier. Some of the bills that have gone through my health policy committee are about lead poisoning prevention. One of the things I'm proud we passed this term is universal mandatory testing of lead in children under the age of 2, so that we can detect lead earlier. And when I was a county commissioner, the Flint water crisis hit, and I looked at the numbers of lead poisoning that was detected in Kalamazoo, and I was astounded to see the number of our children testing positive for lead rivaled that of Flint. And it's not because of our water, it's because of our old housing stock. So whatever we can do to mitigate and prevent lead poisoning, particularly in our most vulnerable population, our kids, I'm very passionate about. Thanks for the question. I got my start serving in the minority on the county commission board, and I quickly learned the importance of bipartisanship. I've modeled that throughout my political career, and I think that we will continue to have close margins. I think Michigan is a purple state, and not only is it the right thing to do, it's just common sense. So I have built relationships with members of the other side of the aisle and shared meals with them. I think when you get out of the Capitol and get out of the Lansing bubble and break bread with your colleagues, particularly if it's in their own district or you welcome them to your district, it really kind of takes some of that emotion out of it, if you will. I also like to say I'm part of the Fun Caucus, the Arts and Culture Legislative Caucus, and that's another opportunity to have bipartisanship and break down some of the barriers that naturally can exist in the legislature. Many of the packages of bills that I have championed, I have intentionally made bipartisan, and I have reached out for Republicans to be sponsors, primary sponsors of bills in the package. One example is the health data utility package I'm working on that would create a pipeline or a framework, with, if you will, so that if you were at one hospital and your home hospital had your most of your health data and you had an accident in another neighboring town, that data could be shared on demand and upon the request of your medical provider. I reached out to my minority vice chair Vanderwall on the health policy committee, and he and I are championing that bill package together because it's a sound policy.